One of the things that's really important to remember about cancer is that it becomes more common as you get older. And so some of the symptoms that we go on and talk about later often aren't as much to worry about when you're younger, but as you get over the age of 50 particularly, we become increasingly concerned about their presence. What must also be remembered about all of the symptoms that could indicate early cancer is that it's much more likely that it isn't cancer causing that symptom. In fact, we know for most of them, by far and away the most likely explanation would be a non-cancerous explanation for the symptoms. When we think about some of the most common cancers that we see within this country, we think about breast cancer in women, lung cancer and bowel cancer. And most of those do present with symptoms early on as they're developing. Symptoms of bowel cancer can include a change in your bowel habit, so how frequently you're going, or the presence of blood. It's much more likely that if you're going more often and you've noticed blood, that it won't be cancer, but it's something that's very important to go and talk to your GP about. Lung cancer can present with a cough that you've not previously had before, or a change in a cough if you suffer from any condition that might give you a cough over a long period of time. A cough that's producing blood when you spit it out is certainly a symptom that would be important for you to get checked out with your doctor. Breast cancer usually presents with a lump, and that's the most common symptom that people tell me that they experience. Sometimes it can present with a discharge from one of the nipples, often with a small amount of blood in it. Again, the presence of a lump on its own doesn't mean that you have cancer. It's more likely that you don't have cancer. What it says is that it's a good idea for you to go see your GP or another health professional and just get that looked at a little bit further. Some of the other cancers can be slightly more difficult to identify, and we look for slightly more general signs. So lumps that are increasing in size, particularly that have lasted for more than 2 or 3 weeks, is something that we occasionally see, or unexplained weight loss, where you're not otherwise stressed or eating less. Skin cancer is a particular concern for people, particularly with the use of sunbeds and holidays abroad to sunny climates. When we look at skin lesions that are worrying, we particularly look for change, and so that change occurs usually over a short period of time, of a few weeks or a few months, and usually involves an enlargement in the size of the mole. And we're particularly looking at moles that look irregular in shape or irregular in colour, or are larger than about 7 millimetres. Fortunately, the majority of skin cancers that are caused by the sun aren't worrying and don't tend to spread around the body, but that doesn't mean that it's not important for that to get looked at further. In addition to the symptoms that people can experience in the early signs of cancer, there's a number of screening programs that you'll be invited to through your life, looking to try and spot cancer either just before it forms or when it's at its very early stages. We have 3 main cancer screening programs. We have a cervical screening program, which is women from the age of 25 being invited every 3 years in for a smear, usually with a practice nurse. It's a very simple and quick procedure and has been incredibly effective in reducing the number of people that die or are caused harm by having cervical cancer. The second screening program is a screening program for breast cancer, which is offered to women over the age of 50. Again, this is a relatively straightforward procedure and is often done local to where you live, and it involves something called a mammogram. The third screening program that's offered within this country is a screening program for bowel cancer. This, at the moment, is being done by a test called an FOB, and you'll receive a small envelope with a package in it through the post. And in that, you use 3 small samples of stool, put onto a card, and that's sent off to the lab to examine it. And all of these are really effective ways of trying to detect cancer early and get the treatment that you might need to treat it and cure it. If you go and see your GP and your GP thinks there is a possibility of cancer, they're likely to refer you to the hospital via a system called the 2-week wait system. And this means that you will be seen by one of the specialists or be having tests to try and diagnose the problems within 2 weeks of you seeing your GP. And now this is terrifically important because we know the sooner we can detect these problems, the sooner we can do something about it. Fortunately, it's very rare that these things present as an emergency and these symptoms present as an emergency, but when they do present in this way, then you'll be seen at hospital and often asked to see your GP to arrange the necessary follow-up. So if you think you have any symptoms that could suggest an early diagnosis of cancer, I urge you to go and see your GP or a health professional at your surgery who can talk to you about them and hopefully allay some of the fears that you might have, but also be able to manage and refer you as you need to be referred.